World Breastfeeding Week is held from the first week of August every year to promote exclusive breastfeeding and amplified focus on child and maternal care. Supported by the WHO, UNICEF, as well as the Ministry of Health and civil society partners. This year's theme aims to close the gap and deliver breastfeeding support for all. The week-long campaign will celebrate breastfeeding moms and drive advocacy to strengthen exclusive breastfeeding for Gambian babies. Among the planned activities is a press conference aimed at providing platform for distinguished speakers and experienced healthcare professionals to address various aspects related to breastfeeding. They will shed light on the numerous benefits of breastfeeding and challenges faced by mothers who are often left to do everything alone with little or no support during this critical period. What can communities and families do to ease the difficulties breastfeeding mothers undergo, and what is being done at the national level to augment breastfeeding? These are important questions health practitioners and stakeholders will seek to answer as they observe the week-long commemoration. Health Promotion and Education Officer Sanjali Trawale highlighted that breastfeeding supplies all necessary nutrients in proper proportions, protecting against allergies, sicknesses, and obesity.
The advocacy is we want to tell the whole world, especially the employers, that not only the children to have access to breast milk, but also their mothers should be given that opportunity to give time to their kids to be breastfed. I know there is increased number of women in the workforce. Many people are being employed in formal sector and even some in the non-formal sector. So I think that advocacy is important for employers to understand that women should also be given the opportunity to give time to their kids to breastfeed.
Yulia Widiati, Child Survival and Development Manager, UNICEF, disclosed that the Gambia is among a few countries that achieved significant progress in implementing exclusive breastfeeding, with 5 out of 10 children exclusively breastfed, according to current estimates.
UNICEF is supporting the government of the Gambia to remove these barriers. Today, as we mark this special occasion, we reconfirm our commitment to support the government and call on government of the Gambia to 1. Ensure investment in breastfeeding by creating national line budgets for breastfeeding to strengthen practices, policies, and programs. 2. Ensure that at-risk mothers and infants, those in underrepresented communities, and those in emergencies receive equitable provision of breastfeeding protection and support to address their unique needs adequately. 3. Enforce the Breastfeeding Promotion Regulation 2006 on marketing of breast milk substitutes with national monitoring mechanism to routinely report code violation, including digital marketing practices.
Director of NaNA, Malang N. Fofana, stated that the campaign seeks to celebrate breastfeeding mothers in all their diversity throughout their breastfeeding journey, while showcasing the ways families, societies, communities, and health workers can support every breastfeeding mother.
The World Alliance for Breastfeeding Action, the World Health Organization, and UNICEF established the World Breastfeeding Week initiative to promote exclusive breastfeeding for the first 6 months of a child's life. This has many health benefits, including providing vital nutrients, protecting infants from fatal diseases like pneumonia, reducing food insecurity, fostering bonding, love, growth, and development. Every child should be breastfed optimally. And by that we mean initially breastfeeding within the 4th hour of birth, breastfeeding exclusively in the first 6 months of the child's life, followed by continued breastfeeding with appropriate complementary food up to 2 years and beyond, regardless of background status.
The celebration will also showcase the need to improve breastfeeding support amid efforts to reduce socioeconomic disparities, with a special focus on breastfeeding in times of emergencies and crises. Fatou Dibba for GRTS News.